Good morning, everybody, and welcome to UPMC Northwest. My name is Royanna Ewing, and I'm the healthcare administrator here at the facility. I'm here to talk to you today about managerial epidemiology and decision-making in healthcare. So, managerial epidemiology, what is it and how does it affect you? Managerial epidemiology designs and manages healthcare for populations and utilizes effective management resources to maintain and promote the health of populations. We study here at our facility, we study mortality, morbidity, and infection rates. We frequently use cohort studies, patient surveys, and follow-ups with certain cases. So for example, oftentimes we'll complete a case study where we'll follow the patient from the time that they're admitted to the time that they're discharged, and basically assess our employees and see how we're doing and how the customer is satisfied. So an example of a managerial issue that we're currently facing here at UPMC Northwest is our hospital readmission rates, specifically from our cardiac facility. The national average for 30-day readmission in the United States is 15.6%. Here at UPMC Northwest, we're looking at 18%, which is obviously 2.4% higher than the national average. So our goal is to get that number down. So the reason we're having this in-service today is so that I can familiarize you with our potential process of how we're going to fix that. The data that we're calculating here is risk. We want to see if the patient poses a significant risk of readmission before they're discharged from the facility. So we created a checklist. And an easy way to remember the checklist is the algorithm CASMACT. I know that's a little silly, but bear with me. If you ever forget this checklist or this algorithm, just go ahead and flip your badge around and you'll see it on the back. So CASMACT stands for Cognitive, Activity Level, Suitability, Medications, Availability, Community, and Transportation. So specifically, before the patient leaves, we want to assess their cognitive status. Are they responding to our questions? Do they know what day it is? Do they know who the president is, etc.? Their activity level and their functional status. Are they able to eat? Are they able to walk? Are they able to read? Can they answer questions that you're asking them? S, we're assessing their suitability of their home. So if they're in a wheelchair, are they going to be able to get the wheelchair from their living room to their bedroom? Are they able to use the restroom on their own? Are they able to obtain their medications? So that leads into M. Is there somebody available that can get their medications for them? Are they able to take them on their own, etc.? Availability of family or companion support. So if we've answered no to the last couple of questions, is there somebody around that's going to be able to help them? And if not, that leads us into C. Is there a visiting nurse, hospice care, or anybody else in the community that's willing to help this individual out on their road to recovery? And lastly, transportation for follow-up. Are they able to get back to us if need be? Which, again, is what we're trying to avoid. We're trying to lower these readmission rates. So something that we've implemented in addition to the checklist is telemedicine. And the future is now, it's 2020, telemedicine is a beautiful thing. So some of the benefits of telemedicine are no transportation time or cost, no need to take time off work, access to specialists, and less chance of developing a new illness. So let's talk about access to specialists. As you know by now, Seneca, Pennsylvania is a very small area. We don't have all kinds of specialties here. However, UPMC is a very big network, and across the state of Pennsylvania, we have access to all kinds of specialists. So rather than sending them to that individual face-to-face, they can contact them via telemedicine. And then less chance of developing a new illness. In times like today, with viruses going around, such as the coronavirus or just your seasonal flu, these patients that have underwent serious cardiac procedures, they're very susceptible to new illnesses. So implementing telemedicine and giving them the option could potentially save their life. It is important that you as an employee are familiar with this movement so you understand exactly where we're at and where we want to be. If you ever forget the algorithm, as I said, just go ahead and flip your badge around. So the decision for discharge will ultimately rely on you, the employee. So from our end, on the administration team, we have given you all of the tools that you need. We've given you the checklists, we've given you the resources, and you will be the ones talking to the patients and going over this and deciding whether or not they truly are ready for discharge. Once we've collected enough data to determine whether or not the checklist is effective, then we can move forward and decide to permanently implement it or to look at something else. However, in my opinion, I personally believe that this checklist is going to significantly lower our readmission rates and get us at least at the national level, if not below. That pretty much wraps up my portion of this. So if you guys have any questions, I'm happy to stick around afterwards and answer any questions you may have. These are the references that I got for the readmission rates, if you're curious. And that pretty much concludes my in-service. So again, welcome to Seneca, Pennsylvania. We're glad to have you, and more importantly, welcome to UPMC Northwest. We'll see you around.